First up, we're going to be talking about the trapezius muscle. The trapezius is a large, superficial, fan-like muscle found on the back. It is innervated by the motor accessory nerve and can be divided into three distinct sets of fibers. The descending trapezius, which originates from the superior nuchal line and external occipital protuberance, and inserts onto the lateral third of the clavicle. The transverse trapezius, that originates from spinal process of cervical vertebrae 7 through thoracic vertebrae 12, and inserts onto the medial acromion and spine of scapula. And the ascending trapezius, that originates on spinal processes of thoracic vertebrae 4 through 12, and inserts into the medial end of the scapular spine. Each of these muscle fibers aids in a distinct action. The descending trapezius is responsible for elevation of the scapula, ipsilateral flexion of the head and neck, and extension of the head and neck. The transverse trapezius, meanwhile, is responsible for retraction of the scapula, while the ascending trapezius aids in depression of the scapula. Up next, we're going to talk about the latissimus dorsi muscle. This is the widest muscle in the body, and is innervated by the thoracodorsal nerve. Being so broad, it has multiple points of origin and can be broken into 4 distinct parts. The vertebral, costal, iliac, and scapular components each have their own origin point. The vertebral originates from the spinal process of thoracic vertebrae 7 through 12. The costal originates from the ribs 9 through 12. Iliac from the iliac crest, and scapular from the spinous process of thoracic vertebrae 4 through 12. All of these fibers then come together and run between the ribcage and humerus, inserting onto the anterior part of the humerus in the intertubercular sulcus. The latissimus dorsi muscle is responsible for multiple actions, including extension of the arm, depression of the shoulder, adduction of the arm, medial rotation of the arm, and extension of the shoulder. Next, we're going to talk about the levator scapulae muscle. This is a small, deep muscle innervated by the dorsal scapular nerve. It originates from the transverse processes of cervical vertebrae 1 through 4 and inserts on the medial border of the scapula and superior angle of the scapula. The levator scapulae has 2 distinct actions. It is responsible for the elevation of the shoulder and ipsilateral flexion of the neck. Next, we have the rhomboid major muscle. This is innervated by the dorsal scapular nerve as well. It originates on the spinal process of thoracic vertebrae 2 through 5. And inserts into the medial border of the scapula. The rhomboid minor is a small muscle with the same shape as the rhomboid major and lies slightly above it. It is also innervated by the dorsal scapular nerve. It originates from the spinal process of cervical vertebrae 7 and thoracic vertebrae 1 and inserts into the medial border of the scapula just like the rhomboid major. Both the rhomboid major and minor share a similar action, which is a retraction of the scapula. Moving on to the pectoral region, we'll first talk about its most significant muscle, the pectoralis major. This muscle is innervated by both lateral and medial pectoral nerves and consists of 3 parts, the clavicular and sternocostal heads, and a variable abdominal part. The clavicular head originates from the anterior aspect of the medial half of the clavicle. The sternocostal head, which is the largest part, originates from the anterior aspects of the body of the sternum, as well as from the anterior aspects of the superior 6 costal cartilages. The abdominal part arises from the aponeurosis of the external abdominal oblique muscles. However, this head may be absent in some people. The muscle fibers from all 3 parts run laterally, converging towards the proximal humerus, and give off a broad tendon that inserts along the bicipital groove. The pectoralis major muscle is responsible for multiple actions, including transverse adduction of the shoulder, medial rotation of the arm, flexion of the shoulder, depression of the shoulder, and adduction of the shoulder. Next, we'll talk about the pectoralis minor muscle. This is innervated by the medial pectoral nerve and arises as 3 separate heads from the anterior surface of the 3rd, 4th, and 5th ribs near the corresponding costal cartilages. The muscle extends superior laterally to form a flat tendon, which inserts into the medial border and coracoid process of the scapula. The pectoralis minor is responsible for 2 distinct actions, protraction of the shoulder and depression of the shoulder. This is achieved as the pectoralis minor exerts a force on the coracoid process, pulling the lateral aspect of the scapula inferiorly, while the levator scapulae and rhomboids pull upwards on the medial side of the rotation axis. Next, we're going to talk about the serratus anterior muscle. This muscle surrounds the ribcage and is innervated by the long thoracic nerve. It can be broken into 3 distinct parts: the superior, which originates between the 1st and 2nd ribs and inserts onto the superior angle of the scapula; the intermediate, which originates between the 2nd and 3rd ribs and inserts onto the medial border of the scapula; and the inferior, which originates between the 4th and 8th or 9th rib, depending on the individual, and inserts onto the inferior angle of the scapula. The serratus anterior muscle is responsible for a couple actions. The contraction of the entire muscle leads to anterolateral movement of the scapula along the ribs. Due to the pull of the inferior part at the lower scapula, the shoulder joint is shifted superiorly. In contrast, the superior part of the muscle acts antagonistically by depressing the scapula. Another function of the serratus anterior is the active stabilization of the scapula within the shoulder. Next, we're going to talk about the subclavius muscle. This is innervated by the subclavian nerve and originates by a strong tendon from the sternal end of the 1st rib near its articulation with the costal cartilage. The tendon spreads superolaterally and inserts into the lower surface of the middle third of the body of the clavicle at the groove for the subclavius muscle. The primary action of the subclavius muscle is to stabilize the clavicle at the sternoclavicular joint during movements of the shoulder and arm. Furthermore, its contraction leads to depression of the sternal end of the clavicle and subsequent elevation of the first rib. This movement is rather insignificant, but helps prevent dislocation of the clavicle at the sternoclavicular joint during certain types of activity.